Today I want to talk to you about the relationship between vitamin D deficiency and sexual dysfunction. This is a new era that we're entering, and it's a very interesting paper that just published in the Journal of Atherosclerosis. We know that vitamin D deficiency has been connected to many different types of cancers: aggressive prostate cancer, colon cancer, Parkinson's, and many other diseases. But we haven't heard too much about vitamin D deficiency and sexual dysfunction. In this particular study, when they looked at about over 3,000 men, and they asked them a simple question: do you get a firm erection good enough to have an intercourse? And if the answer was never or not likely, they checked their vitamin D, and in 30% of the time they found out that if your vitamin D is really low and it's less than 20, you would have a much higher chance of a sexual dysfunction. That's very interesting, especially as a urologist and a lot of men's health experts, where there would be some sort of a knee-jerk reaction when it comes to sexual dysfunction. The prescription for Viagra and Cialis and Levitra would be out quickly. Now we should be thinking about perhaps checking the vitamin D and find out if it's really low or not. Why? Because by just giving supplements, 4,000 units of vitamin D for 2 weeks, followed by maintenance of 2,000 per day, and maintaining your vitamin D over 30, you should be able to get some of your sexual function back, and that's quite interesting. We also know that low vitamin D, especially among African Americans, lead to aggressive prostate cancer. So places like New York, where we're not getting a lot of sun, you are covered most of the time, your vitamin D perhaps could be low, and that can lead to fatigue and being tired, etc. But think of vitamin D as almost like a hormone in the body that can affect many different organs, many different diseases. So number one, if you're suffering from sexual dysfunction, these pills may or may not be the answer. Check your vitamin D, find out what it is, and if it's less than 30, supplement it and take those vitamins. If you don't want to take the vitamins, then you get it from your food. You have salmon, you have eggs, you have fortified cereals, you have it in red meat, etc. There's a whole source of vitamin D that you can get. And under close surveillance of your doctor, you can follow that, and hopefully you will have a better sex life and better health. My name is Dr. David Samadi. I'm always here to help you. 212-365-5000. Thank you.